Hello, everyone, and thank you for joining our webinar this afternoon. Thanks so much for logging in. You are logged into an informational webinar regarding an opportunity to receive training and technical assistance through the Family Connections in Correctional Facilities project. My name is Lindsay Kramer, and I'm a research associate at the Urban Institute in Washington, D.C. Thanks again for logging in. Before we get started with today's webinar, I wanted to discuss a few logistical points before jumping into the content. First, please note that you are all muted during the entire webinar. You can also place your own phone on mute if you'd like. Second, we will be reserving about 20 to 30 minutes at the end of today's webinar for some question and answers about this TTA opportunity. If you'd like to submit a question, please feel free to do so during the webinar through the Q&A chat window in your webinar browser there. You can send your questions to Urban Institute webinar questions. We'll be collecting those throughout today's discussion and then reading them aloud at the end and providing some answers. Also note that today's webinar is being recorded, and we will be sharing out a link to the recording of the webinar following the event today, as well as a link to several other documents, including the formal request for applications. Now I'd like to introduce today's speakers and walk through an overview of what will be covered on today's webinar. So first, we will be hearing a welcome and opening remarks from Rachel Bruchette, a Senior Policy Advisor at the Office of Justice Programs in the Bureau of Justice Assistance. Through the Diagnostic Center at the Office of Justice Programs, Rachel has supported the provision of customized training and technical assistance to numerous communities across the United States experiencing public safety and criminal justice issues. Next up, we'll hear from Hillary Cuthrell, a correctional program specialist at the National Institute of Corrections, and she'll provide us with an overview of the Family Connections project, as well as some of its background and importance. Hillary's work at the National Institute of Corrections has focused on parent-child contact and visiting in both state and local correctional facilities throughout the country. Next, we will hear from Bryce Peterson, a Senior Research Associate at the Urban Institute, who will describe in detail the model practices designed to help correctional administrators remove the barriers that inhibit children from maintaining relationships with their incarcerated parents. Bryce's research portfolio has largely focused on examining and studying issues related to the impact of incarceration on children and families. Next, we'll hear from Alina Martinez, Lead Coordinator with the One Family Program at Community Works West in California, and she will provide us with some examples of how these model practices have been implemented through the One Family Program. As Lead Coordinator, Alina oversees and manages all aspects of the One Family Program, including contact visits and parenting education at the San Francisco County Jail in San Bruno, California. Lastly, Jocelyn Fontaine, a Senior Research Fellow at the Urban Institute, will walk us through the submission requirements and process for the request for applications for this opportunity, as well as the types of training and technical assistance that will be available. Jocelyn has more than a decade of experience in criminal justice research and has specific expertise studying the impact of incarceration on families, fathers, and children. So thanks again. Next, I will turn it over to Rachel, who will share some opening remarks.
Excellent. Thank you, Lindsay, and good morning or afternoon, depending on where you are, to everyone, and thank you for joining the webinar. As Lindsay said, my name is Rachel Bruchette, and I'm a Senior Policy Advisor at BJA. We're very excited that you all are here today and to join us in this conversation. As you saw in the opening page, BJA is funding this project, so we're very excited by how many of you are interested in participating. The effects of parental incarceration on families and children has been a long-standing focus of several federal agencies, including BJA, and BJA has been actively involved in a number of efforts over the years, including safeguarding children of arrested parents, which resulted in a model arrest policy for law enforcement agencies when making an arrest when children are present or while making an arrest of someone who is a parent. And BJA has also played an integral role in the Federal Interagency Working Group on Children of Incarcerated Parents, which is a subgroup of the Federal Interagency Reentry Council. This work has focused on identifying, developing, and disseminating resources to help practitioners work with children and families experiencing parental incarceration. So building on BJA's investments in this area, we're partnering with our friends at NIC to fund this Family Connections project to identify and develop a set of model practices to help foster and maintain contact and communication between family members affected by parental incarceration. We're also very excited to be joined by our partners at Urban Institute on this work, as well as at Community Works. We're very excited to be moving forward into this TTA phase, and we're very excited that you all were able to join us, and we look forward to being able to potentially work with you all in the coming future. So thanks so much, and welcome again, and I'll pass it back to Lindsay.
Great. Thanks, Rachel. And next we have Hillary, who will give us a background and an overview of the Family Connections project.
Welcome from NIC, and thank you all for joining our webinar today. We are excited to know so many people are interested in this important topic. We know families and children impacted by incarceration is a critical issue. Nearly 5 million children in the United States have experienced parental incarceration over their lifetime. Parental incarceration can contribute to emotional, financial, and residential instability among children and their caregivers, often impacting child well-being both short and long-term ways. Incarceration can disrupt familial ties and pose significant barriers to contact and communication for family members, making it difficult for children to see, touch, talk to, and interact with their parents. So in response to these challenges, BJA partnered with NIC to fund the Family Connections project to develop, implement, and evaluate a set of model correctional practices that can reduce barriers and help foster contact and communication between family members while a parent or loved one is incarcerated. This project builds on prior NIC efforts to identify and document innovative practices for children of incarcerated parents, particularly practices implemented in the early stages of the justice continuum. In the first year of the Family Connections project, BJA, NIC, Urban Institute, Community Works, and a group of subject matter experts developed the Model Practices for Parents in Prisons and Jails, Reducing Barriers to Family Connections Guide, describing 10 low-cost, high-impact practices correctional facilities can implement to help children cultivate or maintain their relationships with their incarcerated parents. The Family Connections project is now seeking applications from correctional facilities to implement these practices. NIC is looking forward to partnering with practitioners and leaders in the field on this important work and to adding to the knowledge base on supportive practices for children and families.
Thank you, Hillary. Next up, we have Bryce Peterson from the Urban Institute, who will walk us through the model practices.
Thanks, Lindsay. Thanks, Hillary. So I'm going to spend some time today talking about the Model Practices Guide that Hillary just referenced. So again, this was created last year as the first year of this project. And the purpose of this guide is to be a resource for all of you as you're developing your applications. The document's available for download at the NIC microsite. It requires a username and password to view the document. So if you looked at the webinar materials, or if you go to the website, you can go ahead and see the login, the username and password, so you can download that document. So as Hillary mentioned, the purpose of the document is to provide you with a list of different practices, which we define as policies, programs, or other sorts of things you can implement in your facility meant to improve family connections. It's not an exhaustive list, meaning if there are things that you want to cover or include in your application that's not included in this document, feel free to do so. Don't be limited by what's in there, but think about what best fits your facility. I'll spend some time on the next slide talking about how we develop the document. But first, let me just give you an overview of what's included in there. So there's 10 chapters. Each chapter outlines several practices. I'm going to walk through that document in just a second. But to give you an idea of what's in the document that I'm not including in the slides, there's a resource indicator for each practice. That resource indicator is an estimate of the resources you might need to implement a practice. So it goes from low, medium to high. There's a readiness checklist at the beginning of every chapter. That readiness checklist basically is a list of prerequisites that you should think about having in place before you think about implementing a practice. And then within each chapter, there's several pictures and other resources at the back of the chapter that can guide you when you're selecting or implementing a practice. So I'm going to talk a little bit about how we developed the document. So first we covered a literature review and a scan of practice. So we looked at what's being done currently, what's most effective. We also conducted interviews with subject matter experts, as Hillary mentioned. These included correctional professionals, researchers, and several other folks and stakeholders in the field. So we really wanted to give this a flavor of what folks in the field, so the administrators, the practitioners, and the frontline staff in corrections, what they think is most effective and what's working. So the end result was a document that was geared for both prison and jail administrators who want to remove some of the barriers that inhibit parent-child relationships while also focusing on safety and security. So again, the goal here is to think of practices that are best suited for any type of correctional facility that focuses on parent-child relationships while also keeping safety and security in mind. So what I'm going to do now is I'm going to walk through the document. As I do, I want to list each of the chapters and the practices that are held in those chapters, but just note that these are not prescriptive, so they don't tell you exactly how to implement a particular practice. Rather, you should see this as a framework or a guide or a model for how you should think about developing or building on or implementing any of the practices that you want to include in your applications. So again, the document, as we're listing all of these things, consider it a guide or a reference you can use in your application. So you should be referencing the particular chapters if they're relevant for your application, but don't feel tied down to this specific document. Okay, so I'm going to walk through each of the chapters. So the first chapter is on partnership building. What you should notice on each of these slides, again, I'm going to cover these somewhat quickly, but if there's any questions about the practices or the document itself, please send those to us and we'll answer them at the end of the presentation or the webinar. But the way the slides are set up, the title at the top is the chapter title, and then the bullet points underneath are the practices or the things that we recommend you implement. So I'll talk broadly about each of these, and again, any questions you have, give them to us and we'll answer them at the end. So the first two chapters are what we can consider to be foundational chapters. That is, chapters that should be the base of any other practice you want to implement. The first of those chapters is on partnership building. For any of you who have already begun to implement family connections related programming in your facilities, you'll know that partnerships are really critical. It's difficult, for example, for a facility to implement a visiting program or a parenting class without having the appropriate partnerships with community-based organizations in place. Partnerships might also include other governmental agencies like child services, human services, probation, etc. So that's one thing to keep in mind. In your applications, you should be referencing what partnerships you have in place that will support the work you're proposing to do. You might also identify partnerships that you would like to create, but maybe that aren't already in place in your jurisdiction. The second chapter in our document is the other foundational chapter, and this focuses on training and core competencies. Again, we call this a foundational chapter because none of the programs or policies that you might propose to implement will be effective without first addressing the training needs of the staff. So there's going to be staff that are implementing these practices. If they're not trained or equipped to handle this new program or practice, that practice is not going to last and it's not going to be effective. So in your applications, you should highlight what trainings you will provide to your staff as part of your program or your proposed work, or at least identify the training needs that we can support through our training and technical assistance that we would be offering to you if you're selected as a pilot site. So keep those two things in mind. Again, the first two chapters are really key, and we build off those two chapters in the rest. The third chapter in the guide is around intake and assessment. The guidebook is set up sort of chronologically. So the third chapter, which is really the first one after what we're calling foundational chapters, is intake and assessment. And the last chapter I'll be talking about today is on reentry. So it kind of builds on the entire process or the time a parent spends in a correctional facility. So intake and assessment is an important time to address parental needs or family needs, because one, you have to identify who's a parent when they're coming in. Two, you should try to identify, once you know who's the parent, identify what their needs are. And three, identify whether you have the services in your facility to address those needs of the parent. So there's questions you can just incorporate into an intake process that will allow you to get at that information. And so the other benefit, I think, to this chapter is that these are very easy, low-cost practices that you can implement that could be really critical to the success of your program overall. So take a look at that chapter and think about ways to incorporate questions like this or practices like this in your intake and assessment process. The next chapter we have is around information provision and notification. So this is something that we've heard quite a bit from folks, is from family members when they go to a facility, especially young children as they go to a facility to visit their parents. It can be a very frustrating or confusing process. It's also kind of scary when you get into the lobby there. And so what happens is people get turned around either because they didn't have the proper paperwork in place, they weren't notified beforehand that their incarcerated parent was not available for a visit that day. And so the information provision process can really be hurtful to parent-child relationships in a facility. And so what we do in this chapter is we outline different practices for making the notification and information provision process better for children and families, providing helpful information on your website and inside your facility that makes it easier for parents and children to stay in contact. Up on the slide, you'll also notice one of the resources that we highlight in the document. Again, every single chapter in the document has resources listed there. This one here is on the Pennsylvania Department of Corrections website. And again, it's for children who are looking to visit their incarcerated parent in the Pennsylvania system. The next chapter we have is around groups and classes. And so this is a very common type of practice. Many of you probably have programs in your facility right now that are set up as a group or a class. These can range from parenting classes, relationship classes, and others. And they might focus on things like child development, providing techniques on parenting, building relationships with co-parents or caregivers, or something like that. And what these programs and classes do is they help parents become stronger sources of support for their children, improve their ability to effectively communicate with their families. And so again, as you're thinking through what programs or practices you want to expand on or build on or create brand new, read through this chapter and see if you can identify a need in your facility for something like this. The next chapter we have focuses on lobbies. So again, this is what we consider to be very low-hanging fruit. Many lobbies in correctional facilities are an intimidating and especially unfamiliar place for families to come visit, particularly young children. They go there, it's this very stark, cold environment, and it's not very welcoming. So what we do in this chapter is provide a few very easy to implement and inexpensive ways for facilities to update their lobbies and make them more welcoming for children. So again, in the chapter, we include as a resource for you all pictures of different child-friendly lobbies around the country. The one pictured here is from Washington County, Minnesota, and just gives you a sense of how easy this is to do and a potentially a very effective thing to do. Like lobbies, the next chapter we have, so kind of building on the visiting lobby, we talk about visiting spaces and how to make visiting itself a more child-friendly or family-friendly process. In particular, what we do in this chapter is we describe ways that you can develop a parent-child visiting program, a full contact visiting program in your facility in a way that encourages child development, but also maintains safety and security. And I want to say, so some pushback that we've seen in the past from this is that this is a contact visiting program is easier to implement in prisons and not so easy to implement in jails. In our experience, and you'll hear in a few minutes from Alina, this is something that jails can do too. There are several jails across the country that have really successfully implemented a contact visiting program between parents and children. So that's something to keep in mind. And what we do in this chapter is we talk about ways, again, to make that better for child-parent bonding, for child development, while also focusing on safety and security. So that includes making the visiting room friendlier, allowing children and parents to spend time together engaged in natural, regular family activities like playing games, eating a meal together, reading a book, etc. And again, we include in here several pictures of ways to make visiting rooms more child-friendly. For those facilities who simply cannot have a contact visiting program for whatever reason it is, this chapter does also outline ways to make a non-contact visit more family-friendly. So you should certainly check this out either way. If you're ready to make a contact visiting program in your facility, this chapter provides a lot of resources and guidelines on how to do that. If you just want to improve your visiting process as it is, even if it's a non-contact visiting process, check out this chapter as well. So expanding on visiting policies, that's one form of communication, obviously, between parents and children. The chapter after that focuses on the other types of visiting policies. So in this chapter, we talk about ways to enhance telephone calls, letters, and electronic communication in a way that provides more opportunities for children to connect with their parents in a low-cost kind of supplement to visits. So again, check out this chapter and think about different ways to enhance or revise your policies around communication. Our second to last chapter is focused on caregivers. Caregivers are kind of a missing piece sometimes in this whole process. They're even though they're really critical, not only do they take on the responsibility of child guardianship, but they're also the gatekeepers in a lot of ways to all of these practices. They're the ones who are going to be responsible for taking a child to a correctional facility. They're going to bear the burden of the costs of a collect phone call being made, or again, just being, they're going to have to be involved in all of these different things. And so making sure that their needs are addressed so that they're willing to buy into this process and make this process successful is really, really critical. So what we do in this chapter is we outline practices to support caregiver needs, and we encourage you all to consider them when you're crafting your application and implementing any family-focused service in your facility. Think about ways that you can support caregivers and make that last. Okay, the final chapter we have in the document is focused on reentry. So again, we're building on from intake to reentry and how you can incorporate families into that entire process. So in this chapter, we talk about planning early for reentry and making sure that children and families are included in that process. More often than not, family members are the ones who take parents in once they're released from a correctional facility, and that can be a very trying time for that family. The families of the parent are going to be financially responsible. They're going to be sources of emotional support, and so preparing them as early as possible to receive that parent once they're being released from the facility is really important. It makes the return more successful and easier to facilitate. It also allows the family members to have some time to mentally prepare for that and to financially prepare for it if they need to. So again, just to highlight, in each of these chapters, we provide several different resources to consider when you're thinking about a particular topic or practice. So you can see on this slide, there's a reference to a coaching packet that was developed for the Bureau of Justice Assistance on engaging families in reentry. And then these resources, again, are sprinkled throughout the document. And that's it for me.
Fantastic. Thanks so much, Bryce. We'll turn it over now to Alina Martinez from the One Family Program to give us some examples of these model practices in action.
Hi, great. Community Works West is a nonprofit organization based out of the Bay Area in California that has seen the successes of some of these model practices outlined by Bryce. Thank you so much, Bryce, for that. CWW's approach is to develop programs both in the community and in custody that will help clients and their families access their inner power to work and live to their full potential. With over 20 years of experience, Community Works has used their insights on lasting change to keep people out of prison, advocate for a more humane justice system, and support healthy communities for all of us. CWW programs encompass family services, youth development, restorative justice, and violence prevention. The implementation of current family strengthening practices we have in place now required thorough collaboration between clinical program and correctional teams. CWW's in-custody parenting program, One Family, is one example of how a community-based organization partnered with the corrections facility to successfully implement some of the model practices outlined. This program started inside of San Francisco County Jail Number 2, which is our smallest and our women's facility, after a full year of collaboration with the SF Sheriff's Department and stakeholders from the SF Children of Incarcerated Parents Partnership. As the success of the project at CJ2 expanded, it was evident that the need for family connection services was widespread. We found that as the community of parents is created, they start to shift the culture of the entire setting. When there's a strong community of parents who are dedicated to the children, it impacts their actions in every moment, including in custody behaviors, context of phone conversations, and overall daily interactions with their peers and deputized staff. Additionally, the positive impact on the children witnessed by the caregivers was something difficult to ignore. Caregivers reported stories about more positive attitudes in their children, decreases in behavioral concerns, more positive self-esteem, and improvements in academic efforts, some of which our own program staff was able to witness during the contact visits here in place. The benefits for both the corrections facility operations and the children was what compelled the continued partnership with CWW. the Sheriff's Department, and community stakeholders to implement practices that support family connections. The expansion to multiple facilities created the need for CWW to collaborate with the captains and facility commanders to construct policies and procedures that would allow a parenting program to function within safety and security protocols at their respective facilities. Examples of some concerns addressed included assessment of eligibility criteria of participants, the scheduling capacity for a parenting education course within the current facility programming schedule, deputized staff training on family dynamics, the physical capacity for a child-friendly visiting room. Our discussions were simply just framed by whatever concerns and questions the facilities had. With the extensive discussions, policy revisions, contract drafting, and general collaboration, we have successfully operated an in-custody parenting education program across all 3 of our county jails, including our outdated maximum security facility. As lead clinician at SF's largest facility, I have been heavily involved in all aspects of the model practices in place at CJ5. I do a lot of community outreach for potential partnerships like that of CWW and the SF Sheriff's Department, supporting caregivers, program services, program behavioral contracts, and safety and security procedures for the children entering the facility for contact visits. I've also had a role in implementing the services offered by our program, which include individual therapy and clinical counseling, in-custody parent-teacher conferences, parenting education courses, and the parent-child contact visits. Although all of the listed services are powerful, I'll take just a few minutes to highlight the last listed service as it's quite unique to the in a correctional facility environment. With the practice of contact visiting, we witnessed the power of a physical connection between a parent and their child. This model practice provides a safe and therapeutic space that allows parents and children the opportunity to stay connected through this very difficult time. It allows the support in healing the pain that may be present in the relationship or the pain from the separation itself. It can bring some reassuring relief to the child in feeling safe and secure as they can see that their parents are okay and are able to express how much they miss their parent. This creates an opportunity for the child and parent to experience joy together in an otherwise painful experience, an opportunity to strengthen their parent-child bond. And lastly, it creates a space for the child to be able to physically touch and hug their parent, holding the potential to reduce the trauma a child will usually experience during this time of their parents' incarceration.
All right, great. Thank you so much, Alina. That was very insightful. Next up, we'll hear from Jocelyn Fontaine at Urban to walk us through the application submission process. A really quick note before we pivot to Jocelyn, feel free to continue to submit your questions through the Q&A tool in your webinar browser. You can chat Urban Institute webinar questions. And now I'll turn it over to Jocelyn.
Thank you so much, Lindsay. So as has been discussed, the goal, again, of the Family Connections and Correctional Facilities Project is to help reduce the barriers to contact and communication between parents experiencing incarceration and their children. And Alina and Bryce and the other panelists as well talked about how important that is. To accomplish this goal, we're currently seeking correctional facility partners that are interested in participating in this project by implementing activities, policies, practices, which Bryce just outlined a few and are detailed in the Model Practices Guide that can foster this familial contact and communication. So apply now. We're currently interested in partnerships and are accepting applications on a rolling basis through the deadline of September 28th. As is indicated on the slide here now, applications are due to Lindsay Kramer at LCRAMER@urban.org before midnight on September 28th. As you're thinking about pulling together your applications, I'm sure some of the things that Bryce said piqued your interest, but I want to tell you a little bit about what you can expect from participation in this project and why you might want to get involved. Each selected site will receive training and technical assistance from subject matter experts at the National Institute of Corrections, the Bureau of Justice Assistance, Urban Institute, Community Works, and others. You will have access to a dedicated TTA team that will provide support throughout the implementation period, which may continue for up to 12 months, depending on what your specific implementation plan is and what each site's specific needs and practices are. Selected sites will also benefit from peer learning opportunities, such as access to webinars, trainings, and virtual peer consultation activities that are facilitated by the project team, which again includes us here at Urban, Community Works, the National Institute of Corrections, and the Bureau of Justice Assistance. I want to tell you also that the project team is benefiting from strong collaboration with a group of subject matter experts who are identified in the Model Practices Guide that you can download, and you saw some of the quotes that were peppered throughout Bryce's presentation are just a few of those subject matter experts that we can also rely on to provide the TTA for this project. And finally, this project offers selected sites a tremendous opportunity to promote their efforts and experiences to the field. We have proposed a pretty robust dissemination plan specific to this project, and so selected sites' participation in this project, as well as your specific implementation experiences, will be included in public-facing documents that come out of this project and disseminated through the Model Practices Guide, which we plan to update based on sites' implementation experiences, as well as other reports, presentations, and webinars that we're planning to do. Your efforts, should you choose to be a part of this and be selected, will be used to demonstrate the potential of these practices and to motivate other interested sites about the importance of advancing this work. Participation in this project and demonstrating the practice's potential will place selected sites at the forefront of a national discussion on how to mitigate the impact of parental incarceration on children and families. So again, applications are due now or as soon as you can pull them together through the end date, which is midnight on September 28th, or before midnight, September 28th. So who is this opportunity for? Up to 5 sites will be selected to participate in this opportunity, and training and technical assistance relevant to the selected practices will be provided to each site. Right now, any correctional facility that's within the United States is eligible to participate in this project, and this could include a city or county jail, a regional jail, a state, or a federal prison. Correctional facilities that wish to collaborate with local partners to carry out the practices may do so, and in fact, as Bryce just indicated, we encourage participation with local partners. However, only correctional facilities may serve as the primary applicant under the authority of the appropriate public administrator, such as a county or state executive, warden, or correctional department chair or director. So again, this is an open opportunity for any correctional facility that houses adults within the United States, but we encourage partnerships, but the correctional facility should be the primary applicant. We are really interested in partnering with a diverse cohort of correctional facilities and invite participation from all types of facilities. The model practices that Bryce just outlined were designed to be applicable in facilities of different security levels located in rural or urban settings and comprising inmate populations that vary in size, lengths of stay, and demographics. That's all to say we are really interested in seeing what you're able to come up with and demonstrating the power of these practices by implementing them in different types of facilities. So what should your application include? We're requesting applications that are no longer than 5 double-spaced pages in length using some standard font. So we hope that this isn't a heavy lift for folks. And your application should include, first, a short description of the correctional facility or facilities where the practice or practices will be implemented. So we want some basic information about the average daily population size, demographics, the geographic location, and security level. We're also looking for a statement of interest in the practices or activities that support parent-child communication and contact during incarceration, and evidence of prior experience or experiences with such practices. So essentially, your interest statement is your statement of your agency or department's mission, vision, and commitment to the practices and the overall goals of this project. We're also looking for an implementation plan, which will outline which practice or practices your facility is interested in implementing, in what facility or facilities, how implementation will progress over time, including relevant partners and stakeholders and your histories of collaboration, and a discussion of your available implementation resources, facilities, capacity, and staffing and leadership. We're also looking for a statement of the training and technical assistance needs that you may have. We want you to articulate how you envision using or needing the TTA team and our partners to support your implementation plan. And we're also looking for a preliminary implementation timeline, so what you're planning to do when, over this up to a 12-month period. And then finally, we're also looking for a statement of data capacity and availability, which will be used to assess progress and outcomes. A statement of your data capacity and availability may include details on what and how your average daily population, composition, program participation and attendance, institutional behavior, recidivism, and cost of practices are collected and how they may be shared with your TTA and evaluation team. Finally, and really important, each applicant must include a cover letter of support from the relevant key public administrator, such as the director of the Department of Corrections or the warden, that outlines the significance of the proposed practice or practices, identifies any partnering organizations, relevant prior experiences, and affirms the support and willingness of the signatory to participate in the project. As I want to make clear, I am saying practice or practices on purpose, and that is because we're looking for applicants that include one or more of the model practices that Bryce outlined. We're really leaving that up to the applicants to decide which sorts of practice or practices that they're interested in implementing as part of this project. So now I'll talk about how sites will be selected. Since resources are available to provide TTA with the selected sites, and the intention is to demonstrate that these practices have positive impacts, every effort on our part will be made to identify those applicants where the conditions for maximum implementation progress, success, and impact are present. The project team also endeavors to select a group of sites that together represent the variations in correctional facilities across the country, and to select sites that together represent the continuum of activities in the Model Practices Guide. So with a maximum score of 100, we will be using the weighting criteria that you see on the screen here, where the interest statement is 15% of the applicant, the rating total. The implementation plan will count for 50%. Training and technical assistance needs will count for 10%, timeline for 10%, and data capacity and availability for 15%. All applicants will be notified of a decision of their application by email from the project team by October 26, 2018. So we're planning a pretty quick turnaround from the application deadline to when you'll know that you've been selected. So what kinds of TTA are we planning to offer, and what can you expect as part of participation? I just want to give you a flavor of the types of TTA that we envision. As is probably quite obvious, very much will depend on the sort of practice or practices that you plan to implement and the specific needs of your agency or facility. So each selected site will be assigned or designated a TTA team that will work closely on the implementation plans and goals with you. Site-specific TTA plans will also be developed, which will be focused on the specific practice or practices of the selected sites. We envision that the TTA team will include relevant staff from the National Institute of Corrections, the Bureau of Justice Assistance, the Urban Institute, and Community Works. And we may also tap the subject matter experts as necessary that helped us develop the Model Practices Guide, as well as to use some of the examples that we showed you on the other slides of people who have done this in other places in similar contexts. The TTA that we're offering will be executed both remotely and on site. So we're planning to have frequent conference calls with the selected sites, as well as on-site engagement. So you'll see your TTA team in person, and will be highly dependent on the practices that are planned to be implemented. The TTA may include thought partnership to troubleshoot issues or challenges in planning and implementation, how to develop trainings, how to make modifications over time, how to do partnerships or convenings. It may also include electronic or hard copy materials such as resources, manuals, and guides that have been implemented in other places under similar contexts. As Bryce showed in his previous presentation, we have examples of intake assessments and how-to guides and implementation manuals or pamphlets that can advertise specific program or practice, and we could make them available to you or connect you to folks in the field who have done this work in other places. We also are offering or may offer meeting facilitation and partnership. So someone from the TTA team can help you facilitate meetings with partners, can help create meeting agendas, or facilitate the meetings or presentations related to policy development, to trainings, or specific practices. We also may offer guidance on selecting activities, trainings, or program curriculum. So for example, the current project team has extensive experience doing research on various parenting curriculum and assessments, and we can help selected sites think through different curriculum or activities, the potential benefits and challenges of implementing specific programs and the trade-offs, and making connections to other practitioners who have engaged in these activities in other places. We may also do or offer formal presentations on the model practices, since we spent the last year working collaboratively with subject matter experts on the policy guide development. Then we're here to offer formal presentations on those model practices in detail and help you think about which of those you'd like to implement in your own jurisdiction. And finally, the TTA may include assistance developing performance measures and data collection instruments to document implementation and impact. And so having said all of that, what that means is in your application, we're looking for your best kind of statements and thinking about all of these things, about a TTA plan and about an implementation plan. But the idea is that the project team, which includes researchers and practitioners and policymakers, will work closely with you over the implementation period of up to 12 months to really hone in on your activities and help you be successful with implementation. So I just want to show on the last slide here, for more information about this project and access to the request for applications that I just gave you a flavor of, are available on the NIC microsite and are also available on the Urban Institute events page that you use to register for this opportunity. So we will, following this conversation, be sending out an email with a recording of this webinar, and attached to that will be the formal request for applications, but you have access to that now by going to the NIC microsite and or to the Urban Institute events page. And with that, I'm going to turn it over to Lindsay.
Great. Thanks so much, Jocelyn. And as Jocelyn just mentioned, there's quite a bit of this information available on the NIC microsite. And I think we've already gotten a few questions about how to get access to the Model Practices Guide. It is available on the microsite. Here is the username and password. The username is guest-user, password guest-pass. And also you can direct any questions about the Family Connections Project broadly or NIC and BJA's investment in this area to Hillary Cuthrell at hrunyon@bop.gov. Questions specifically about this request for applications and the submission process can come to me at lkramer@urban.org. That's the same email address where you will submit your application. So we've received a lot of good questions so far, quite a few about the proposal submission process. I think I'm going to kick it to Jocelyn to answer some of these, particularly around how many facilities can apply, or does it have to be the whole Department of Corrections, or can it just be one facility therein? What's our thought on that?
So, as Bryce outlined, the model practices are specific to certain things or aspects of the correctional facility or the correctional environment, but they are intended to be broadly applicable to various facilities of different sizes or demographic orientations. So we're really looking to the applicants to let us know where you think it makes the most sense to implement these practices in your own facility or facilities. So yes, we are looking for applicants from one facility, or so that is potentially a warden might want to apply in partnership with other local kind of stakeholders or partners. Or we're looking for applicants from a Department of Corrections that's wanting to implement a new intake assessment that will be rolled out in all of the facilities under their purview. So we're really open to different types of applicants, again, one facility or multiple facilities. Another question was, how narrow should an applicant focus? That is really up to you. If because of the needs of your facility and where the momentum is, or again, where the need is, if you want to focus on males versus females, then we invite that as well. That is really up to you to do some really hard thinking about where the greatest need is and where you think that a partnership with the TTA team that we are providing can help you make the most meaningful impact in more firmly establishing or repairing family connections and communication. So it's really up to you to demonstrate the interest and the thinking around this and where you think TTA will be most impactful. We're really looking forward to what you all come up with.
Great. Bryce, I'm going to kick the next one to you, and it reads, do the partners have to use a specific program, or can we choose our own program to implement, should we be selected?
We definitely encourage all applicants to choose a program that best suits their needs. So we're not prescriptive in the model practices guide about which program. We're happy to help you think through that. So for example, in your application, if you've already identified a program that you think fits the needs of your facility and the population, your incarcerated population, certainly you can propose that. If in your application you instead choose to say, we need a parenting program or a parenting curriculum, and we would like help selecting one, that's also something we could provide through the TTA. So certainly we're open to the curriculum that best suits your needs.
Great, thanks so much, Bryce. Another question, this one also for Jocelyn, how many applications will be funded?
So we want to make clear that this isn't a funding opportunity specifically, but instead this opportunity is providing TTA, training and technical assistance by subject matter experts at BJA, NIC, the Urban Institute, and Community Works. So at this time, there is no funding that is specifically available under this opportunity, but what we are providing is TTA and the opportunity to be part of this project by disseminating your experiences, your implementation experiences, successes, and challenges to the broader field about the role of these practices and how they can potentially be impactful to children and families.
Excellent. I think, Bryce, this one is suited for you as well. What if a site, or what if we are already implementing a program, policy, or practice and want to receive TTA to make it better? Can we still apply?
Yes, we would encourage applications. So in your application, then what you would do is you would clearly articulate what you're already doing and how it is that you want to expand it. What would probably not work in an application would be saying, we have this program and we want to make it better, without providing clear details and as to where we can help out with providing TTA and areas you want to expand it. So for example, if you had a visiting program that you wanted to expand, either by making it full contact, or you wanted to update the room you're using it in, or you want to incorporate other sorts of program or practices into your visiting program. So if you want to hire new coaches or staff members to be part of that program, that's something you could certainly include in an application. So yes, we encourage, we anticipate receiving applications from people who are already engaging in this type of work, but want to expand on it. And if you have specific questions about what you think is appropriate or not for an application, you're welcome to send that to us as well, so we can help you put together the best application possible.
Great, thanks so much, Bryce. Our next question, what are the expectations of selected sites? And for Jocelyn.
Thank you. So the expectations of the selected sites are that you will implement one or more of the model practices that we've outlined. And as Bryce indicated in his presentation, those are guides. The model practices that are outlined in the draft document are not intended to be exhaustive. They're pretty comprehensive, but not exhaustive. So we're looking for your best thinking there. And we're expecting that you work closely with the TTA team. So you're expected to engage with the TTA team on an ongoing basis, commit to ongoing kind of monitoring and evaluation, and participate in virtual learning opportunities. The TTA team will also work collaboratively with all of the selected sites to provide TTA in a manner that complements the site's availability and does not place an undue burden or time commitments on the sites or local stakeholders. And we say that, and it's important to us, we recognize that this isn't a funded opportunity, so we expect to deliver the TTA and make kind of requests that are related to our evaluation of how things are going in a manner that doesn't put an undue burden on the sites. As much as sites can articulate their resources, the things that they already have available for TTA and evaluation and monitoring, that would also be helpful to our site selection process.
Fantastic. And just as a reminder, feel free to continue submitting questions through the Q&A tool in the webinar chat window. Next up, a question, are you looking for university or research partnerships as part of this opportunity?
And I can answer that as well. For the applications, we're looking for the correctional facility or department to be the primary applicant on that, but we certainly invite partnerships with local universities or researchers that can help the facility with the documentation of the implementation successes and challenges, or how the practices or practice might be related to outcomes and success. So an applicant that includes a research or university partnership would be a strong one, because certainly that provides us with a very good indication that that site has a good handle on data collection and analysis, which will be really useful for our evaluation purposes.
Great. Another question, what is the timeline for project implementation? I think Hillary, do you want to take that one? What is the timeline for project implementation?
Sure. So we plan to notify the applicants of our final decisions on or before October 26th. And so the implementation period will be up to 12 months. And that kind of is, that varies and sort of depends on the proposed activities for which we identify per site. And then the project initiation is tentatively scheduled for November or December 2018. And then the project initiation is planned to also include like a planning conference call with relevant stakeholders from Urban Institute, of course, Community Works, BJA, and NIC, as well as an in-person kickoff meeting with the selected site.
Great, thanks so much, Hillary. And I'm actually going to send another one your way. This just in, how long are you expecting these projects to be implemented, or how long are you expecting the period of TTA to be?
Right, so the TTA would be dependent upon which model we identify as most useful for the site. So it is site specific. At most, we can commit to up to 12 months. So it would be up to 12 months or perhaps less than, depending on the needs of the correctional facility that we identify, the model practices that we plan to implement. And after that, we would hope for the site to continue their work and their effort within this endeavor that we identify, but our TTA is committed up to 12 months.
Great, thanks so much. And thanks to everyone for submitting your questions. We are nearing the end of our time here, so we're gonna pivot into some closing remarks. Please feel free to keep sending your questions, again, questions related to this opportunity and to the submission process to me, lkramer@urban.org. You can direct your questions about the Family Connections Project broadly to Hillary. Our emails are up again on the screen currently, as well as the link and the login information for the NIC microsite. We will be responding to questions on a rolling basis. We will also be posting our answers to these questions on Urban's events page, as well as the microsite, along with, again, the recording of today's webinar. So thank you again, everyone, for your time. I'm going to pass it off to Hillary to wrap us up with some closing remarks.
Great. I just wanted to say from the National Institute of Corrections, Bureau of Justice Assistance, Urban Institute, and Community Works, thank you all for joining us on the webinar today, and thank you for your interest in supportive practices for children and families in the justice systems, and we really look forward to receiving your applications.
All right, great. Thank you so much, Hillary, and thank you all for your time.